Will the House please come to order and members kindly take their seats? Good morning. The devotional today will be led by Chaplain Eric Stupert of the Vermont National Guard.
Good morning. Thank you, Representative Stone, for sponsoring my time this morning. On behalf of the thousands of citizen soldiers and airmen serving in the Vermont National Guard, especially those currently deployed, thank you for your continued support of our forces. For this morning's devotional, I chose a verse from Ecclesiastes 4, which states, "Though one may be overpowered, two can defend themselves. A cord of 3 strands is not quickly broken." If you were to go to the Army Mountain Warfare School in Jericho and did some rappelling, you'd want your rope or your cord to be strong, made of multiple strands to keep you safe as you make your way down the rock face. As leaders in Vermont, I want to encourage you to think about 3 strands that when combined will help you lead us well over the next year. The first strand is knowledge. Become a scholar, someone who loves learning. As a chaplain, I want to encourage you to continue learning about God and spirituality, of course, but grow in your knowledge of multiple topics. Study the issues that Vermonters face. Read good books, listen to good podcasts, and have quality conversations. Continue to learn as much as you can about those you serve. What does a day in their life look like? What's important to them and their communities? The second strand is wisdom. Wisdom is simply the right or correct use of knowledge. What's the best way to use the knowledge you've gained to make the best decision for Vermonters? Many times, wisdom comes with time, life experiences, and dialoguing with others. But I believe God also gives us wisdom when we ask. However you acquire wisdom, let it guide your decisions as a body. The third and final strand that creates a strong cord is character. One positive element of character is personal courage. In the Army, this is one of our core values. It's described as continuing forward on the right path, especially if taking that path is not popular with others. To be courageous is to acknowledge the fear, danger, and adversity, and still choosing to do what's right. This is an indicator of a good leader, whether in the Army, Air Force, or in the House of Representatives. If you, our leaders, desire to grow in your knowledge, wisdom, and character, Vermonters' lives will improve over the years and decades ahead. These 3 strands will create strong leaders who can't easily be broken. I will now offer a prayer. Almighty God, I thank you for your many blessings upon those in this room and throughout Vermont. You have blessed us with incredible beauty in every season, yes, even in mud season. I ask that you strengthen the leadership of Vermont, those in the Guard, in Congress, the governor. May their knowledge, wisdom, and character increase this year so that the Vermonters may prosper. I ask these things by the authority of my Lord and my God. Amen. Thank you.
Members, we have 3 House bills for introduction today. House Bill 129 is an act relating to the state aid for school construction program introduced by Representative Brady of Williston and others. Please listen to the first reading of the bill.
H-129, an act relating to the state aid for school construction program.
Now the bill has been read the first time and is referred to the Committee on Education. House Bill 130 is an act relating to expanding the membership and duties of the Advisory Council on Harassment, Hazing, and Bullying Prevention in Schools, introduced by Representative Minier of South Burlington and others. Please listen to the first reading of the bill.
H-130, an act relating to expanding the membership and duties of the Advisory Council on Harassment, Hazing, and Bullying Prevention in Schools.
Now the bill has been read the first time and is referred to the Committee on Education. And finally, House Bill 131 is an act relating to Reach Up grant calculation, introduced by Representatives Garofano of Essex and McGill of Bridport. Please listen to the first reading of the bill.
H-131, an act relating to Reach Up grant calculation.
Now the bill has been read the first time and is referred to the Committee on Human Services. Are there any announcements? Member from Westminster.
Thank you, Madam Speaker. I have a guest in the gallery today. His name is Ron Boslin. He's my husband. He's a kindergarten teacher in Springfield at an elementary school, obviously. And he's happy to be able to visit this morning when he has the day off.
Will the family member of the member from Westminster please rise and be recognized? Are there any further announcements? Member from Burlington.
Madam Speaker, Chaplain Major Eric Stepford serves in the Vermont Army National Guard as the full-time support chaplain in the 86th Infantry Brigade Combat Team Mountain Chaplain. That's a mouthful. He has served in the Vermont Guard for 12 years and deployed to Kosovo in 2021. He lives in Wheelock, Vermont with his wife, Tessie, and their 4 children. Please join me in thanking him for his service to our state and our country and welcome him to the chamber.
We thank the chaplain for his devotion. Are there any further announcements? Member from Fairfax.
Thank you, Madam Speaker. Today I have a guest in the gallery. Today I have Anna Howard as my first legislator of the day. I want you all to remember that name because not only is she interested in going into international trade and economics, but she is ranked 18th nationally for archery. So I don't even know how you get there, but she's done it. So if the body would help me in welcoming her today, I would greatly appreciate it.
Will the guest of the member from Fairfax please rise and be recognized? Are there any further announcements? Member from Bennington.
Good morning, Madam Speaker. I'm very honored this morning to introduce to the body the Board of Trustees from the Vermont Veterans Home. They're in the card room today. I hope you all take the opportunity to stop and visit with them. Today we have Melissa Jackson, who is the CEO of the Veterans Home, and a number of the board of directors as well as staff. If you could please welcome them.
Will the guest of the member from Bennington please rise and be recognized? Are there any further announcements? Member from Colchester.
Madam Speaker, as we are all aware that our country experienced a tragic loss when an American Airlines flight collided with a military helicopter over the Potomac. In an instant, we lost 67 innocent souls and left their families at a loss as to how they would survive this nightmare. I would like to ask our chamber to take a moment of silence to remember those who were lost and to pray for their family, that their families find the strength to cope with this huge loss.
Will members please rise and join me in a moment of silence? Are there any further announcements? Seeing none, orders of the day. Members, we will begin with House Bill 31, which is an act relating to claim edit standards and prior authorization requirements. The bill is referred to the Committee on Healthcare, which recommends that the bill ought to pass. The member from Essex, Representative Black, will speak for the committee. Please listen to the second reading of the bill.
H31, an act relating to claim edit standards and prior authorization requirements.
Member from Essex.
Thank you, Madam Speaker. Today, I'm presenting H31, an act relating to claim edit standards and prior authorization requirements. This can be found on page 13 of today's House calendar. Throughout 2024, a diverse and comprehensive group of interested parties have been meeting and working collaboratively together to ensure that the provisions of Act 111 from 2024 are administered correctly. Some of you may recall Act 111 from last year as the bill that pertained to prior authorization requirements and claim editing standards. Throughout their work, it became clear that there were additional clarifications that were required, and H31 is a culmination of those discussions. Section 1 of the bill pertains to the processing of claims and the adherence of claim editing coding rules. This section amends 18 VSA 9418A that requires health insurers to follow certain standards when they edit claims, healthcare claims, by adding an exemption for claims for healthcare services that were delivered out of state unless the payer and the out-of-state provider agree that one or more of the edit standards will apply. Essentially, claims are processed by payers based on where the provider is located and the contract that the payer has with that provider. It's not where the patient happens to live. And we cannot regulate how claims are processed outside the borders of Vermont. Section 2 specifies in 18 VSA 9418A that the definition of primary care for purposes of the exemption from health insurance prior authorization requirements for most services ordered by a primary care provider means a healthcare provider who is contracted and enrolled with the health plan as a primary care provider. As we do not actually have a definition of what primary care is or a primary care provider is in statute, we originally used a definition as defined by the Blueprint for Health. And there was some confusion over whether the primary care provider must be enrolled in the Blueprint for Health to be considered for exemption from the certain prior authorizations. This now makes it clear for the purposes of prior authorization exemptions that providers who contract and enroll with a health plan as primary care providers are the primary care providers that will qualify for this exemption. Section 3 are the effective dates. Section 1 regarding claim edit standards takes effect on January 1st of 2026. And Section 2 regarding the definition of primary care provider for prior authorization purposes takes effect on passage and must be implemented by health plans as soon as reasonably practicable after that date, but in no event later than January 1st of 2026. As the prior authorization section of Act 111 already took effect on January 1st of this year, payer systems are using the definition as providers enrolled in the Blueprint for 2025. And they'll need to wait until the next plan year to make changes to their systems. Section 3, the effective date section, takes effect on passage. Act 111 was an important step that this body took in 2024 to support our provider community in reducing administrative burden. And it's important that we get this right. And the reasonable changes in H31 are our efforts to ensure that we get this right. We heard from the Executive Director of Vermont Medical Society, Deputy Commissioner of Insurance of the Department of Financial Regulation, the Director of Public Policy by State Primary Care, Vice President and Government Relations for the Vermont Association of Hospitals and Health Systems, the Director, Government, Public and Media Relations, Blue Cross Blue Shield of Vermont, Senior Director of Government Affairs from MVP Healthcare, and Government Affairs from Cigna Healthcare, and Legislative Counsel from the Office of Legislative Counsel. H31 had unanimous support from all the interested parties, and we thank them for working collaboratively in ensuring that Act 111 is administered and carried out correctly. Your Committee on Healthcare also unanimously supports this bill, and on a vote of 11-0-0, we ask for your support. Thank you.
The question is, shall the bill be read a third time? Are you ready for the question? If so, all those in favor, please say aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and third reading is ordered. The final item on our action calendar today is House Resolution 5, which is a House resolution authorizing limited remote committee voting through the remainder of the calendar year 2025. This resolution has been read and appears in yesterday's journal. It was introduced by the Committee on Rules. The member from Heartland, Representative Bartholomew, will speak for the committee. Member from Heartland.
Madam Speaker, as the title suggests, HR 5 deals with remote voting, committee voting. And you can find it in yesterday's journal on page 101, or you do build search on our legislative website. This resolution is based on a similar House resolution from last biennium, HR 13. That resolution was effective through the end of 2024, so we currently have no provision for remote voting participation in our committees. The resolution provides a limited number of days in which a member of a House committee may vote remotely and count toward a quorum. Looking at the resolution, it's effective through the remainder of calendar year 2025, and it allows each member of a House committee to vote remotely in that committee for not more than 3 days. That member must notify the committee chair and clerk that the member is exercising this remote voting authority and that shall count towards the quorum. The resolution also requires the committee clerk to record any vote cast by the member as a remote vote and to track the number of days the member exercises this remote voting authority. So this is not a very complex resolution. Your committee vote on this was 7-0-0 in favor of the resolution, and we ask for your support.
The question is, shall the House adopt the resolution? Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and the resolution is adopted. Members, that completes the orders of the day. Are there any announcements? Seeing none. Member from Poultney, can you please offer us a motion to adjourn until Tuesday, February 4th at 10 a.m.?
Madam Speaker, I make a motion this body stand in adjournment until Tuesday, February 4th, 2025 at 10 a.m.
You have heard the motion. Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and this body stands in adjournment until next Tuesday at 10 a.m.